You are on your knees in the dark, gripping a strip of leather tied to the roof beam. Your back is wet. Your legs are shaking. Someone behind you is telling you to breathe, but breathing is no longer a choice. It is something your body does between waves of pain. There's no hospital, no fetal monitor, no surgeon waiting down the hall, no clean steel tray, no blood bank, no antibiotics, no one who can promise that both of you will survive. There is only firelight, older women, and the terrifying fact that a new human has to come out of you. For modern people, childbirth is usually treated like a medical appointment that became dramatic. For most of human history, it was closer to standing at the edge of the species itself. Every person alive came through this danger, and millions of women entered it without doctors. So what was childbirth actually like before medicine took control of the room? The answer is not just pain. It was knowledge, fear, ritual, skill, blood, and a kind of female technology older than writing. Let's start with the problem built into the human body. Birth is hard for many mammals, but human birth is unusually strange. Our ancestors stood upright, which changed the shape of the pelvis. Then our brains expanded, which made infant heads larger. Evolution did not solve this neatly. It negotiated. The human baby is born early compared with other primates, weak, unfinished, and helpless. Because if it stayed inside much longer, the head would be too large to pass through. In the 1980s and 1990s, anthropologists Wenda Trevathan and Karen Rosenberg helped explain why human childbirth is so socially intense. In chimpanzees, babies often emerge facing the mother, so she can reach down and guide them. In humans, the baby usually rotates through the birth canal and emerges facing away. The mother cannot easily see the face, clear the mouth, or untangle a cord by herself. That means assistance was not a luxury. It may have been part of the design. This is the part movies get wrong. Ancient birth was not one woman screaming alone in a cave while men hunted somewhere far away. In almost every traditional society anthropologists have studied, birth is surrounded by women, mothers, sisters, aunts, grandmothers, experienced neighbors, midwives with hands that had felt this exact panic before. They watched the belly, the hips, the bleeding, the color of the mother's face. They listened for the change in sound when pain became pushing. That knowledge rarely fossilizes. Stone tools survive. Bones survive. Birth almost disappears. But sometimes, the ground gives us a glimpse. At Ostuni in southern Italy, archaeologists found the burial of a young woman from roughly 28,000 years ago, often called Ostuni I. Near her pelvis were the tiny remains of a fetus, suggesting she died while pregnant, possibly near term. We do not know the exact cause. We only know the silence around her body feels familiar. A woman, a child, a birth that did not finish. Long before hospitals, people built entire systems around that risk. In ancient Egypt, women gave birth on bricks, squatting above the ground while attendants supported them. Archaeologists at Abydos found decorated birth bricks from around 3,700 years ago, marked with protective imagery. To a modern person, that can look like superstition. But a brick also changes posture. Squatting widens parts of the pelvis and lets gravity help. The ritual and the technique were not separate. Safety and meaning were braided together. Across the world, birth positions were often upright, kneeling, squatting, sitting on a birth stool, holding a rope from the ceiling, leaning into another woman's arms. The flat on your back position that feels normal in modern hospitals became common much later, especially in European medical settings where it made the body easier for physicians to examine. Convenient for the observer, not always convenient for the person doing the impossible work. So imagine a likely birth before doctors. Labor begins quietly, not with cinematic panic, but with suspicion, a tightening low in the body. Wetness, a pause in the conversation. Someone notices your face and says nothing too loudly, because fear spreads fast. The older women move you near warmth, but not too close to smoke. They bring water, hides, cloth, maybe plants known to ease cramps or slow bleeding. Some worked, some probably did nothing. Some may have been dangerous, but doing nothing was not an option. Hours pass, maybe a full day, maybe two. There is no epidural, so pain is not removed. It is managed through pressure on the back, changes in position, breathing, chanting, touch, and the one medicine humans have always reached for when the body becomes unbearable. Other humans staying close. They tell you when to rest. They tell you when to push. They lie if they have to. You're doing well. The baby is coming. Stay here. And then comes the dangerous part. The head appears. In many births, this is where the skill mattered most. Too fast and tissue tears badly. Too slow and the baby may suffocate. If the shoulders stick, the room changes. If the baby comes feet first, everyone knows the odds have shifted. If the placenta does not come out or the uterus will not tighten, blood can leave the body with horrifying speed. Postpartum hemorrhage is still one of the leading causes of maternal death worldwide. Before transfusions, it was a clock made of blood. This is why childbirth had its own terror. A healthy woman could be talking at sunrise and gone by sunset. The baby could be alive and the mother dead. The mother could live and the baby never breathe. Or both could die in the same room while everyone knew exactly what was happening and almost nothing that could stop it. For context, in parts of pre-modern Europe, maternal mortality was often around 1 death for every 100 births, sometimes higher during epidemics or in crowded cities. That sounds small until you remember women might give birth 6, 8, 10 times. The danger accumulated. A single birth was a risk. A reproductive life was repeated exposure to the same blade. But ancient people were not ignorant because they lacked modern medicine. They understood patterns. Midwives knew when labor had gone too long. They knew foul-smelling discharge was bad. They knew fever after birth could mean death. They knew a newborn needed warmth, breathing, milk, and a cord cut with something sharp enough not to crush it. The problem was not stupidity. The problem was that knowledge had reached the edge of what hands could do. The medical revolution came painfully late. Cyrannus of Ephesus, writing in the 2nd century, described the ideal midwife as literate, calm, strong, and experienced. That tells you something important. Long before modern obstetrics, people respected specialized birth knowledge. But forceps did not spread widely until after the Chamberlain family guarded their design in early modern Europe. Anesthesia entered childbirth in the 19th century. Antiseptic practice grew after doctors like Ignaz Semmelweis showed in 1847 that hand-washing could stop deadly childbed fever. Think about that. For thousands of years, women survived birth with experience, posture, social support, luck, and bodies, selected by generations of brutal consequences. Then doctors arrived with instruments, theory, and confidence, but sometimes dirty hands. Hospitals did not instantly make birth safe. In some places, they made infection worse before they made anything better. Here's the uncomfortable reversal. Before doctors, childbirth was more dangerous, but it was not necessarily more isolated. The laboring woman was usually held inside a circle of people who knew her name: her mother, her previous losses, her fears, her temperament. Modern birth can save you from things that once killed silently. A blocked labor can become a cesarean. A hemorrhage can meet medication and blood. An infection can meet antibiotics. That is not small. That is civilization doing one of the few things it truly promised. But something changed in the exchange. Birth moved from the floor to the bed, from the home to the institution, from female memory to medical chart. The danger went down, and the loneliness sometimes went up. You can be surrounded by professionals and still feel strangely alone, because expertise is not the same thing as belonging. Before doctors existed, childbirth was not a natural miracle in the soft way people say that now. It was natural the way storms are natural. Powerful, ordinary, beautiful, and capable of taking everything. Every human life begins with someone crossing that storm. Modern medicine built a bridge across it. But underneath, the old water is still moving beneath us all.